So we've navigated to the medical library, and now we're going to move to our either endocrinology or primary care library for this demonstration. We've reached primary care, and we can then navigate to our condition of diabetes. Pre-reading, pre-brief questions, and it's worth always noting that our answers in here are taken into account for our AI assessment report at the end. So if I said I don't feel very confident in taking a diabetes history or medication update, and I perform very well within that domain, my report will reflect that discrepancy. We're meeting with David today, a Nigerian gentleman, to discuss some blood tests. He received a phone call earlier in the week from one of our healthcare assistants at the practice, and my role as the GP today is to take a history from David and explore his recent blood test results, noting a raised HbA1c. Hi David, thank you for coming in. How can I help today?
Hi there. Look, I came in because Gary rang about the bloods, and now it sounds like the numbers up. These shifts don't make it easy. I know my sugars are rising, and I'd like to know what we can do about it without messing up my driving or risking hypos.
Okay, well, thank you for sharing that. Before we start, could I just confirm your full name and your date of birth, please?
Yeah, it's David Adewale, born on 10th February 1983.
Okay, thank you, David. And so you mentioned that one of our colleagues at the practice had phoned you to mention your blood test results had come in. Could you just walk me through what your understanding as to why the tests were done in the first place?
Look, I think it was just a routine check after my last review. Gary did some blood tests, and then he rang me to say my sugars were going up. I suppose they wanted to see how I'm doing with the diabetes.
Okay, that sounds fair. And have you ever had this blood test done before?
Yeah, I've had it done a few times before, I think. Usually it's alright, but this time the numbers seem to be climbing.
Okay, and that's what I'm going to discuss today. So the blood result for the HbA1c, which is a marker of kind of the I guess the longer term management of how well controlled your blood glucose is, has risen quite to a higher number, 91 to be specific. I get the impression maybe this isn't as a shock to you today.
No, it's not a shock. I sort of guessed it might be going up, honestly, with the way I've been feeling and how tricky it is to keep on top of my routine with work shifts and everything. I just want to get it sorted without messing up my driving or risking hypos.
Okay. And walk me through what is it that you kind of do for work at the moment? You've mentioned driving a few times now.
Yeah, I drive HGVs. That's long distance lorry driving. It's pretty demanding with early starts and long hours. Sometimes I forget to take my tablets properly or eat at regular times because I'm on the move a lot. It's not easy to keep everything steady.
Okay. And I haven't got my computer up at the moment to check what medications you're on. But could you just remind me what tablets are you taking at the moment?
Sure. I'm on metformin 3 times a day, sitagliptin once a day, and ramipril for the blood pressure. I sometimes miss the morning and afternoon doses of metformin though with my shifts.
Okay. Is there anything specific maybe we could do to help support you kind of take the medication regularly? Because missing the doses might be one of the reasons as to why this blood result's so high.
Look, mate, I try my best, but with the early starts and being on the road, it's not always easy to remember. I'd like something simple, maybe once a day or something that doesn't mess with my license. But I do want to do better, honestly.
We've got some post-brief questions, good closed reflective thinking after a simulation like this. And all of our tutors overseeing students or trainees can see the answers to these questions. We're then greeted by the transcript of that conversation. As well as audio playback of the entire conversation. Running in the background whilst we reviewed these things is our assessment report. It takes on average 30 to 60 seconds to produce. The assessment report has generated and we've received a grade, and this was set for medical students within the third year, but can be changed to set regarding GP, SCA exams, final year medical students, and so forth. We've got a really detailed assessment report covering a variety of different domains. There were gaps in my consultation. I didn't particularly discuss a management plan, it was only partially developed. But overall, the communication style was patient-centered and respectful. Looking into more finer domains, we've got 6 under information gathering, pulling through quotes of things I've said, and occasionally making suggestions as to how I could have said this better. And then a further 6 domains under communication, continuing that approach of pulling through quotes of things that I've said to act as the evidence. Finally, we can download a PDF report which can go in the trainee's portfolio or act as further evidence